Good afternoon. Thank you for being with us on a Friday afternoon, and particularly a Friday afternoon that is going to lead to a 3-day weekend for many of our fellow Mississippians. Probably not the three individuals sitting at this table, but certainly we have been through so much together during 2020. Memorial Day is a very special day for so many of us, where we remember those who have laid down their lives for our fellow Mississippians and fellow Americans. We want to personally thank them for that ultimate sacrifice. We know that our Safer at Home order is set to expire on Monday at 8 a.m. Therefore, we have to take additional action today, or either allow it to expire. Before I get into the details of the decision that has been made, I want you to know how much I appreciate the people of this state, how much I appreciate your diligence in helping us fight this fight. We have asked you to do things that I never imagined that I would be asking you to do, and by and large, the vast majority of you have participated, and because of that, we have had a relatively flat curve in Mississippi for nearly 45 days. That would not have happened without you. Regardless of where we go from here, it is not over. We know that this virus is still in our communities. We know that we still have challenges in many of our communities. I also know that if we are going to continue this fight, we have to have a posture that is sustainable. We cannot ask the people of Mississippi to do more than they are able to do for a sustained period of time. Over the past 2 weeks, we have steadily opened up more and more of our economy. That is good, and it is the right thing to do. It is necessary. There are very, very few businesses still closed. Honestly, it's mainly just places of entertainment. Today, I have signed 2 executive orders. One of them, which will be effective Monday morning at 8 a.m., will open up outdoor places of entertainment, playgrounds, racetracks, water parks, with strict health guidelines and rules. I've said it before, and I'll say it again. There is no such thing as a non-essential business to those people who rely on its paycheck for their food and for the roof over their head. Do we need racetracks and water parks for most people to survive and live quality lives in our state? No, of course not. But does that small business owner and their employees need them open to survive? Absolutely, yes, they do. That same order makes a few other minor amendments to our Safer at Home order. Outdoor sports practices can go on, and schools can open up their gyms and open up their weight rooms under strict guidelines similar to those in the private sector. I've also signed an executive order to extend our Safer at Home order for 1 more week until June 1st. That is the order which recommends people stay at home as often as possible and asks those in the most vulnerable category to shelter in place. We know that this virus is particularly cruel to those who are over the age of 65. We know that this virus is particularly cruel to those with pre-existing conditions like hypertension and heart disease. We've asked those individuals to continue to shelter in place. My hope and my expectation is that by June 1, we will be able to allow that to expire. However, there will still be guidelines in place for businesses, but we will be out of the business of closing down anybody, I hope. We know that we cannot treat all corners of their state the same. Working with Dr. Dobbs and his team, we have decided to extend the stricter guidelines for those 7 counties that we named several weeks ago. In addition to that, we have decided to add 1 additional county to those more strict guidelines, and that is, again, in central Mississippi, in Holmes County. We are taking this issue very seriously, and I hope the people of this great state will continue to take this seriously as well. The threat is not gone. We must stay vigilant. I know that we're going into a holiday weekend when we are used to gathering in large groups, in cooking out, and having a great time. My plea to all Mississippians is to recognize we still have the virus in every community. Please, if you get together, do so in smaller groups. Please remember to stay 6 feet apart. Continue to wash your hands, sanitize, and wear a mask if at all possible. With that, I will turn it over to Dr. Dobbs for our latest updated numbers. Dr. Dobbs?
Thank you, Governor. So today we're reporting 402 additional cases to bring our total case count up to 12,624. Many of these 402 cases that represent an increase from yesterday are an accumulation of lab reports from the private labs, so nothing that indicates any sort of new outbreak or anything. New deaths, unfortunately 16. 3 of those were identified from previous death certificates, bringing our total death count up to 596. We are currently reporting 102 active long-term care outbreaks. We continue on our mission to test every resident and employee of all nursing homes around the state to be completed within the 2-week time frame as planned. Of recovered patients, we've identified an estimated 7,681 recovered in Mississippi. If we look at our counties with the highest per capita rate of coronavirus in a 7-week span, most recently assessed, the number 1 county in the state is Holmes County. And if we look deeper into the dynamics of Holmes County, we see most of that transmission is occurring in the setting of community transmission and not around any specific industry or in long-term care settings. So certainly we'll appreciate the strong work of the folks in Holmes County to prevent additional transmission there so we can help them get back into a better place. And that's all I have, Governor. Thank you.
Thank you, Dr. Dobbs. I'm going to ask the director of the Mississippi Emergency Management Agency to take us through some of the spending on PPE for the sake of transparency and so that the people of Mississippi get a full picture of the efforts of their team, quite frankly, the heroic efforts of their team, along with the State Department of Health. The purchasing of PPE has been a challenge, shall we say. We have been competing not only with every other state, every other hospital, every other entity, we've been competing with every other country over a period of time. And what I would tell the people of Mississippi is it is critical, as you have heard Dr. Dobbs say over the last week, it is highly likely that the virus is going to return in the fall. It is critical that we as a state have the resources necessary to continue to purchase PPE while it is being produced during the summer so that we don't find ourselves in the early fall in the same position we were in early March, in which we did not have an adequate stockpile to get us through. We had to go out and do lots of acquisitions. So with that, Director Michelle, thank you for being here, and the floor is yours.
Thank you, Governor. I appreciate you allowing me some time to kind of delve off into this a little bit. We have had a lot of inquiries from the press, and rightfully so. Wanted to make sure that we continue to maintain elements of transparency. So just want to dig into the PPE discussion a little bit, and just very briefly, I want to take us back to kind of where we started and what kind of set the stage for where we ended up being. So when we started out this event, right after the President declared the federal declaration, we found ourselves in a situation where our state stockpile was short than it needed, or shorter or smaller than it needed to be. We had limited access to the national stockpile, as we well know, because we talked about that a number of times here. And then there was no established supply chain from normal suppliers, again, due to that national stockpile kicking in those contracts. Now, the national stockpile was never designed to support a global pandemic like this that affected the entire country. National stockpile was designed to handle regional problems, regional issues that affected a number of states, but not the entire United States. So that put a terrible strain in something that a lot of the states like Mississippi had to figure that out. So we had to utilize a very unconventional process for acquiring PPE. You've heard me use that word unconventional, but let me take this opportunity to say it was unconventional, but it was not irresponsible. It was a very process, it was expedited, it was aggressive, but we utilized the most fair approach that we could find to get out and acquire PPE. The federal government used a very unconventional process with the air bridge that President Trump put in place, but it was not irresponsible, it was necessary. So MEMA's strategy for acquiring PPE in conjunction with the Mississippi Department of Health was to get out. Again, it was very aggressive. Unfortunately, it was very costly. It was very costly because of the commercial environment that we found ourselves. The stock was very limited. Therefore, the prices in a lot of cases were very high. And our sources pretty much pointed us into the direction of China, which is where we've all heard on the news and talked about that. So the next step was to get out and vet vendors and to find people to help us to get that. And we had to utilize criteria by which vendors we used. And in cases where we could, we tried to keep that business in the state of Mississippi. But the first and foremost was we needed PPE, we needed it very quickly. So we had to find vendors that were able to front the large amount of capital that was necessary, because the state of Mississippi was not going to wire money overseas, and we did not do that. And I'm very proud to say that we did not do anything like that, and we did not get involved with any vendors in which the state was left on the hook for money that goods were not received. So we were very fortunate with that. Those vendors that were allowed to do that were able to acquire. Not only was capital important, it was also to partner with vendors that understood and could navigate through the complexities of the Chinese customs. And then in addition to that, they also had to have the type of finesse that was necessary to acquire necessary air cargo freight on aircraft, which is very difficult to do. That in of itself was, in some cases, an insurmountable challenge. But we were able to work through those things. And after about 3 weeks, we were able to get our supplies rolling, which is where we are today. So where we find ourselves today is that we have been able to realize that the pressure off the supply system. We're starting to see prices stabilize, and in most cases we're in a much more comfortable state with regard to PPE. Now, we'll tell you that we still have some very high-use items that we're still struggling with in some cases, like gowns, but in partnership with Mississippi Department of Health. Mississippi Department of Health does an outstanding job of calling these Tier 1 facilities on a daily basis, but we still find ourselves in some cases being only 2 to 3 days level of stockage, which is why you hear so many discussions at these press conferences about these runs that the National Guard is doing a very heroic effort with getting out and getting this stuff to the facilities. So it's a very close call. It's a very close daily management of getting PPE out, but we're in a much better situation, and we continue to build that stockpile. And even this week, we have delivered some of the largest deliveries of PPE that we have since the occurrence of this event. Now, looking ahead, with a possible resurgence of COVID in the fall, we're having to purchase Tier 1 and Tier 3 PPE to stockpile that so that we have that on board in the event that we're looking at a resurgence in the fall. So those bids are being put out, and those bids will be vetted and will be posted out to ensure the most fair practices possible, so to allow equal and fair competition across the board, and to ensure that we're getting the best value for our dollar in this process, given that we have some time now to do that. We did not have that luxury on the very front end of this, but we do now, and we're going to make time for that. To date, the state of Mississippi has incurred approximately $62 million in costs incurred, not only, and that is not just PPE, but that also is mission assignments and anything else that's associated with the running of this operation. Of that $62 million, about $20 million of that has been spent out in cash as far as goods received and services that have been rendered on that. The remaining of that is yet to be paid out and will be when goods are received and mission assignments are complete. We anticipate that there will be additional monies that will be required to be spent on this response to ensure the safety of Mississippians. That will be spent on the Tier 1 and Tier 3 PPE that we've talked about. It'll be costly, but it'll be less costly given the fact that we've got time to do it through a bid process and procure it in a much more normal way. So all of these expenses, I might add, that $62 million that we've incurred thus far are all eligible expenses. Those are what FEMA considers emergency protective measures. They are eligible both under the Public Assistance Declaration and also they are also eligible expenses under the restrictions for the CARES Act money. So however the legislators decide to do that, we have ensured that those expenses have been incurred within our regulations. So just wanted to make sure that we went back and kind of discussed that. It's been a very difficult fight. It's been a battle in and of itself. I'm very fortunate to have been working with some great people with the Mississippi Department of Health, the National Guard, and working and doing this. And I can assure you that we have accounted for every cent that has been spent utilizing the taxpayers' dollars, and we've accounted for every item that has been purchased, over 10 million units of items that have been purchased towards this response. So, Governor, that concludes my report, subject to any questions.
Thank you, Director Michelle. I think as we continue to gather the data and the numbers, my guess is by the end of 2020, the combination of the Mississippi Emergency Management Agency, the Mississippi Department of Health, the Mississippi National Guard, and other state agencies will expend somewhere in the neighborhood of between $250 and $350 million dealing directly with state agencies. We will be seeking numbers in that range in the combination of CARES Act funds and other items and other areas, and that's going to be critically important that the emergency management agencies, the Guard, Department of Health, and others receive these dollars through the process, because we have to have these PPE available in the fall. We're going to continue to acquisition those because the response is such that we have no other option but to do so. With that, I'll turn it over to anyone who has questions. Courtney Ann?
It seems like this is kind of a recurring question when the orders are amended, but correct me if I'm wrong, really just indoor entertainment venues are the main things that remain closed. So can you walk people through that process of saying this is why these things will remain closed, but these things will be open?
Right. We were able to, in today's order, open outdoor places of amusement and recreation, which includes amusement parks, rides, water parks, go-kart tracks, mini golf, and playgrounds, outdoor parks. We did so under fairly significant guidelines. There's approximately 20 or so different provisions within the order, which produces the safe way in which to open those outdoor facilities. We've said all along, we believe that transmission in outdoor settings is much less than transmission in indoor settings where they're really, really close. And so we are looking at some of the remaining businesses that are outstanding are, in fact, things like movie theaters, things that where large numbers of people are out in the community. They come into a small confined space indoors. It's not easy to develop guidelines, but we are working with the Department of Health and others to develop guidelines on ways in which they can reopen. And we're hopeful that we can get those reopened by June the 1st. That is our intent. But again, every single day brings new data and new opportunities for us to make better, more informed decisions. And as we move into next week, I've got a team that is working on that with Dr. Dobbs and his team, and we'll announce that just as soon as we feel that it is safe to do so. Yes, ma'am?
I was going to ask you about the outdoor entertainment reopening on Monday. Can you kind of just elaborate more on like the safety measures that are going to be put in place, especially with the playgrounds and water parks and amusement parks reopening as far as cleaning?
Yeah, and I think you hit on something that's very, very important, and that is before any of these venues reopen, it is imperative that that they have areas that the equipment and the rides are deep cleaned, they're disinfected, they are sanitized. That's a bare minimum, and that's rule number one. Let's make sure that there's not transmission caused by the virus living on surfaces. There's debate how long they can do that, particularly outdoors and particularly in the heat. But if we disinfect and clean and sanitize on the front end, that reduces, at least eliminates that piece of the total risk. We've got to do things like ensuring that the waiting areas and the lines to go into these various things, for instance, shall be marked to observe social distancing. So if there's a line to go into a water park, for instance, we know that chlorine probably kills the virus, but if there are lines to go into a water slide, for instance, there needs to be 6 feet apart from each individual who is waiting in line. We have to ensure that all of the employees of these various facilities are provided training regarding minimizing the spread of COVID-19, the ways in which they can ensure proper sanitation and hand washing and things such as that. We want to make sure that we have daily screening of all of those employees to include asking specific questions, and these questions are not unlike all of the other things that we have put in place. Is we've got to do everything we can to make sure that those individual employees, before they enter into these facilities, are at a minimum screened, and hopefully as testing ramps up, maybe we'll have more and more opportunities for testing, although we have seen a very good increase in the daily number of tests being done in our state, thanks in large part to the great work of Dr. Dobbs and his team. Renee?
Jack from Clarion Ledger has a question. Jack?
Yes, can you hear me?
Yeah.
I can hear you, Jack.
Hey, Governor Reeves, do you have a time frame for that small business grant program that the legislature passed, I guess last week now? Now it's been signed. I know it's up to MD to figure out how to distribute the money, but I've had some small businesses reaching out to me just asking, when can we apply? When might these funds be coming out? Is there any timetable that you have for that?
Yeah, Jack, I can't give you a timetable right now. The only thing I can tell you is as soon as humanly possible is what the direction that I have given. The Department of Finance and Administration actually began the process of putting together applications and online portals, not knowing that at the time that the legislature would necessarily tap the Mississippi Development Authority, but fortunately, both the Department of Finance and the Mississippi Development Authority report through our office, and we have hooked them up. They are working together, and I'm hopeful that we will get some of that information out sometime next week. The sooner, the better is the answer. Thank you.
Dave Elliott from WLS has a question.
Okay, I need to unmute. You got me, Governor?
I got you, Dave.
Okay, good. By the way, thanks for doing that interview with us earlier today.
Sure thing.
I have kind of a spin-off question on the first two. You've opened the door on outdoor entertainment recreation. I'm sure you're aware that museums in Biloxi have been open this week. We know about bowling alleys, other indoor entertainment centers that are opening this week as well here on the coast, and we have to assume that's happening all over the state. I know you've given leeway to mayors, but technically it's in violation of your order, so what would you say to businesses and mayors who are allowing these indoor venues to be open right now?
Well, obviously, we are trying to get every business open as soon as humanly possible, as soon as it is safe and secure. There are local leaders have the ability to institute more strict guidelines, but they do not have the ability to institute guidelines that are in direct conflict with executive orders as offered. The enforcement of those are certainly going to be are in partnership with our local elected leaders, and I would hope that our local elected leaders understand that if the Department of Health and I believed that it was safe to open those, that we would have already done so. Again, I don't know of any specifics, but that's certainly something that we'll look into.
Caleb from Daily Journal has a question. Caleb?
This question is for Dr. Dobbs. I'm looking for an update on how extensive the access to rapid testing is in the state right now.
That's a good question. So there's different forms of rapid testing. There's the Abbott ID Now, the same one the president used, and then there's a whole other host of other platforms. There are hospitals throughout the state that have access to it, and we had 15 machines of the Abbott ID Now that we have distributed. The test cartridges are pretty limited, so it's modest still. I can't give you a number, but it's modest. It was going to be a minority of the the tests available, and most of those are going to be done in the setting of a hospital. So it's probably going to be more hospitalized folks or people coming through the ER. In the community, by and large, most of them are going to be sent to a lab, either a private lab or the Department of Health. And then the Department of Health lab, we're running over 1,000 tests a day with 24-hour turnarounds, and so we're doing pretty good on that right now.
The only thing that I would add to what Dr. Dobbs said is the goal would be to get to a scenario within the next 4 to 6 months in which we had significant rapid testing opportunities. But keep in mind that many of these rapid testing programs were developed very, very quickly. It is admitted by all that their accuracy is, well, let's just say their accuracy is not as good as the testing that we're doing at the State Department of Health. I've seen numbers as low as between 80 and 90% accurate, which again, 80 or 90% is better than 20% accurate, but it's still a long way from the 99.8% that you would like for it to be. And so we're continuing to work to hopefully find ways in which to work with the federal government for them to increase production and also increase capacity in every state. But for now, we're not there yet.
Emily from AP has a question. Emily?
My question is for Dr. Dobbs. I wanted to ask again about the testing in nursing homes. You mentioned a few minutes ago that the goal is to get all of this finished by the 2-week deadline. Can you tell us the steps that are being taken? And like, as of today, do you have an idea of is it 50% of people who have been tested in nursing homes? Do you have some numbers you can offer on the progress of that?
I'm sorry, I don't have a precise number, but I can get that. That won't be hard to track that down. We are ramping up. We have done dozens of nursing homes so far. We have about 200 in the state, and I think we had like 18 a day on the schedule at some point. So we're still moving through that quickly. There are a couple of mechanisms for that to occur. Either the nursing homes can do them themselves and submit them through their normal lab process through the private labs, or we'll come do it for them with our partners in the National Guard, and that's been the majority of folks have done that. We've seen some really interesting things, and I think it actually tells a nice narrative. So we have found some unknown outbreaks or additional cases, but in places that have had really good infection control practices, a lot of times we'll find 0 cases. Actually, if they haven't reported any, most of them will not have any cases whatsoever. And so that's fantastic to understand that their processes are working. Or even sometimes we'll find a nursing home that has maybe 1 resident that's known infected, and we'll check everybody else and they're negative, reinforcing that proper infection control done diligently is effective, or maybe even 1 employee and no one else has it. So if we're doing those things that we know we're going to help, it's encouraging, but being strictly compliant with what we know works to prevent the spread of the virus, even in long-term care settings, is going to make a huge difference.
What do you?
Dr. Dobbs, could you speak a little bit more to what's going on in Holmes County? I know that we talked pretty in depth about the 7 counties that were initially named, but can you speak a little bit more to what you guys think is going on there?
Well, every county is a little bit different, and we have a profile that we'll look at every county and kind of see what's going on. In Holmes County, it seems to be just community transmission. We have had some anecdotal sort of communications about people having social events and not really worrying about social distancing, certainly not wearing masks as we have recommended. And there are some associations with long-term care, and there are some associations with different industries, but that's a minority. So most of it's going to be spreading in the community. I know that I talked to the mayor just before we came in, and they're distributing thousands of masks tomorrow, and then I think 10,000 more masks are on the way. So really trying to penetrate the community and make sure they have the resources they need.
The mayor
Of Lexington.
Okay.
Okay, sorry. What did I say?
You just said the mayor, and I didn't know.
Oh, yeah. Sorry about that. Yes.
Just to give everyone in Mississippi an idea, Holmes County is currently listed as having 343 total cases, which is more total cases, for instance, than Harrison County or Jackson County, both of which are much, much larger counties than Holmes. Also as a reminder, the 7 counties that we extended the more strict measures include Atala, Leake, Scott, Jasper, Neshoba, Newton, and Lauderdale counties. We do think that the more strict measures are improving the situation there, but we also believe that we should extend those for at least one more week. Yes, ma'am.
Governor, this question is for you. Some people are wondering why the state hasn't applied for, or if the state is planning on applying for the pandemic EBT program. They feel like that can really help parents feed their children this summer that are struggling.
Yeah, well, we're working with the Department of Human Services and the Department of Education, ensuring that we are looking for every opportunity to get every resource available to every possible Mississippian. You'll recall early on in this process, even when we shut down schools, we actually had buses running and delivering meals to those young people who were typically on free and reduced lunch, for instance, and we're going to continue to look for ways in which to do that. And so we'll reach back out to our folks and get you an answer on that.
Dave from WLX has another question. Dave?
Yes, Governor. As you continue to forge ahead with reopening the state, I'm curious if there are plans in place if there is this second wave in the fall, which is consistent with some models being used today. You even reference it. How difficult would it be to slam on the brakes, even just tap the brakes, to pause, close, shelter in place all over again? It would seem almost impossible to do that.
Yeah, that's a great question, Dave, and I'm going to let Dr. Dobbs address this as well. What I would tell you is when you think about some of the lessons that we have learned, we know more. I think we will be smarter going into the fall than we were in March, and I'm very comfortable saying that a lot of us, at least in the executive branch, went into 2020 not expecting to deal with a global pandemic that we had not seen in 101 years, and I probably had not read quite enough about what happened in 1918 when I got sworn in mid-January. But some of the lessons that we've learned, particularly with respect to things such as the fact that today in Mississippi we're up to almost 50% of our total deaths are in long-term care facilities. That's the reason we are working now to ensure that, and there's been a ton of testing in long-term care facilities, by the way, but we want to make sure that we get 100% testing in long-term care facilities. I think if we see a major resurgence in the fall, there will be another attempt to very quickly get control of those long-term care facilities and protecting those who are most vulnerable. And what we saw in the first 6 weeks of the virus is that deaths, for instance, in long-term care facilities were a high percentage of the overall deaths, but it was closer to 25 to 30%, whereas over the last 6 to 8 weeks, it's been much higher than that. And this is a chart that, to the credit of Dr. Dobbs and his team, they put out every single day. And if you look at the chart, what you see is on the left side of the chart, there's more blue than red, but on the right side of the chart, there's a lot more red than blue. And so those are the kind of things and the knowledge that we can take into the fall when making decisions. Your point about could we completely step on the brakes and go back to a shelter in place, it will be very, very difficult to do so. And quite frankly, it may not be advisable. We will look at we'll look at the situation at that time. I think our people better know now how to address this. They better understand what social distancing guidelines mean. We better understand that those over the age of 65 and those that have pre-existing conditions really need to protect themselves and take care of themselves. And we also know that that every business is truly essential, and that we need to consider both the public health and the economic ramifications should we see a resurgence in the fall. Dr. Dobbs, would you like to add to that?
Yeah, thank you, Governor. Going into the fall, and I'm hopeful that people will be thoughtful about maintaining social distance, not doing unnecessary things. If we do some moderate social distance going into the fall, we'll be in a lot better shape than we were coming into March, because it was already transmitting within our communities before we even realized it. So at least having that foreknowledge is going to be very important. especially when school starts back, and especially when people start going to college and start congregating. That's going to be when our risk is most likely to be highest, and we need to be most careful about having those personal social distancing interventions so we don't have to do anything more aggressive. A couple things I want to mention: there's not going to be a vaccine come fall. It's not going to be that's not going to be here for us before we have a potential second wave. We're not going to have herd immunity. I know we talked about this a little bit, but just from the serology we've received so far, only 2% of people have antibodies in Mississippi. Now, that's not a random sample, but it is what we've seen so far. So the herd immunity concept is not going to be here. We're going to have to rely on the things we know that are going to prevent transmission, and these individual measures will make a big difference.
And I think that's one of the things that we need to realize, and one way in which we can and should be smarter in the fall is what the data bears out for this outbreak in the spring is that there have been and there are a number of individuals under the age of 50, let's say, that have contracted the virus. There is no doubt that if we go back to school, if we go back to college, or when we go back to school and when we go back to college, that there is going to be some transmission that occurs amongst younger people. What we've got to be very sensitive to, because that is, while there are those who have bad outcomes, those are more the exception than the rule, but we've got to think through, and we've got to do this as individuals, we've got to do this as families, to think through the fact that as those kids are potentially being exposed to the virus that probably they will be asymptomatic to, is there a way in which ensuring that those that fit into the more vulnerable category are not seeing a lot of exposure to those same individuals? And so we've got to be smart about doing that. We've got to think about our planning as we go into the fall. And I think that's something that not only we as a government need to be thinking about, it's something that we as individuals need to be thinking about. What are we doing to protect our moms and our grandmoms from a potential asymptomatic transmission from young people to those who are most vulnerable with the virus?
Jack with Green Ledger has another question.
Can you hear me?
I can hear you.
Sorry. Some states have had issues of fraud or cyber attacks. Some appear to be coming from overseas that have successfully scammed states out of unemployment benefits. The state of Washington, for instance, lost hundreds of millions of dollars this way. Have there been any successful cyber attacks or fraud schemes on the Mississippi Department of Employment Security?
Thank you for the question, Jack. There have been, I think it's fair to say, in talking to my fellow governors, I think every state has seen a significant number of attempts, again, primarily from overseas. I am not aware of any successful completion with respect to the Mississippi Department of Employment Security at this time. Any other questions? If not, I will just tell you that we are going to continue to work to make sure that we get everything that we can to the people who need it most. I know that there are 250,000 Mississippians that have applied for unemployment insurance. I know that there are numerous federal programs that we're utilizing through the CARES Act and through other agencies such as HHS, whether it's feeding folks throughout the state, for instance, that are in need, whether it is getting those additional unemployment benefits to the individuals who are entitled to it, but also getting businesses back open so that we can lower the total unemployment numbers. We are committed to trying to have a holistic approach to this response, and I am going to do everything in my power to get as many opportunities and as much help to the people of Mississippi as is humanly possible. So with that, on this Friday afternoon, thank you all for being here, and God bless.